Dr. Huffaker, I want to ask you a few questions today about abdominoplasty, which a lot of times we hear called as a tummy tuck. Who is a candidate for a tummy tuck?
Basically, anyone with loose skin on their abdomen. This usually is someone who's had one or more pregnancies, or someone who has lost a lot of weight, and who has loose skin they can't get rid of themselves. You know that you can tighten muscles up, you really can't tighten skin up, and so basically anyone with loose skin that that hangs down a little bit, they want to get it tighter, anyone like that's a candidate.
So how much tissue, loose skin that you're talking about, and weight can you remove with the tummy tuck?
As much as we need to. You know, generally, on most women, we can take everything, the skin from the top of the pubic hair all the way up to the top of the belly button. If some women, we can take more than that. If you've got more looseness from whatever reason, we can take more than that. The women who are more than that are probably weight loss patients. There's some women who require less than that and may just have what we call a mini tummy tuck done. The only problem with a mini tummy tuck, it doesn't do anything about the upper abdomen. So we'd like to get women in the full or extended tummy tuck situation to get as much skin as we possibly can.
Now, do you recommend a patient to be at their ideal weight for surgery?
No. A lot of people do. I just find that women who come in, if they could be at their ideal weight, they would have been at their ideal weight. They've tried things, they haven't been able to succeed. So I know I can do a tummy tuck on you even if you're not at your ideal weight and make you look a lot better. Now there are different categories. There's a lady who may be 180 to 200 pounds who's if we do a tummy tuck on someone like that, or even below, if they go ahead and lose some more weight after that, they'll still look good because there won't be really that much weight that they'll lose off their abdomen itself. Since we're making the abdomen tight, they'll still look good even if they lose a lot more weight. If they're going to lose more than 50 pounds, you know, maybe they're out of weight, but most women are not in the 50-pound category. Then we have some patients who are 250 pounds or more. And these are heavier women, and they usually have some tissue hanging down. And if we do a tummy tuck on these ladies and excise that area of loose skin that hangs down, what we call the pannus or paniculus, those patients look a lot better, feel better, fit in their clothes better. I had one lady say that she just could go sit in a regular seat in a movie theater with her daughter that she couldn't sit in before. So there's still a lot of benefit. A lot of those women that are that heavy, we find that because there's a big jump in motivation, that they will go ahead and lose a lot more weight on their own, but they don't really lose the effect that they gain with the tummy tuck, since most of the abdomen has been thinned down a lot during the procedure and is tight, so they lose most of the weight elsewhere.
So what actually happens with a tummy tuck?
Well, the tummy tuck, we just excise the extra skin. Sometimes we tighten the muscle, sometimes not. It just depends on how tight the muscle already is. And bring it together and close it. Normally we will do some liposuction with tummy tuck. There are a few women who don't really have fat as any problem, and we can just have loose skin. We can take that out at the tummy tuck. Most women have a little bit along the edges that we need to take out with liposuction at the same time.
So you talked about an incision. How big is that incision?
Most women, it goes from hip to hip. If you're thinner, it may just go from the little bony spines in front of your abdomen that you feel in the front, from one of those to the other one. But most women I see are perhaps a little heavier, and it goes from hip to hip. You have to remember, Michelle, that the wider the amount of skin is that you take out, the longer the incision has to be to get the points to come out right.
So does that incision fade? I mean, I've seen some things on the internet where, you know, they look kind of scary.
Well, the incision fades quite a bit, but the incision is not bad at all. Everyone worries about the incision before surgery. After surgery, it's not even an issue. Contour is the most important thing. You see contour from 20 or 30 feet away. The incision's underneath your suit. Not too many people see the incision. Everybody sees if you wear a two-piece, again, our desire is to get people back into a two-piece suit. Then they see the tight tummy and they don't see the scar. So the scar is really less important. It doesn't look hideous. It's a scar that was not there before, but let's face it, the stretch marks aren't the most beautiful thing in the world either.
And can you remove a lot of stretch marks with that tummy tuck?
A lot of stretch marks, fortunately, are between the belly button and the pubic hair. Those we can get out. If going above, some women have some stretch marks going above the belly button, and so a few will stay around, but if you pull those tighter, they will look better. So they just don't look the same.
So let's talk about the recovery. I mean, I'm assuming that it's probably not as easy as some of the other procedures that you do.
Well, recovery is very important. I encourage women, if they are not already, to start an exercise routine before surgery. We found that people that exercise regularly before surgery simply do better at surgery. After the first week, I like you to walk. So generally, if for tummy tucks patients, especially if we tighten the muscles or combine with some liposuction, we'll keep you overnight one night. The day after that, about the second day after surgery, I want you walking outside. One block the first day, just to see what your tolerance is. Every day after that, I want you to walk farther, so that I want you to really increase your activities. I don't want you just lying in bed. I want you about moving around, because your chance of blood clots are much less if you keep moving. People that just want to go lie in bed and wake me up in a week, they're really setting themselves up for blood clots. And we keep some little special stockings on your legs during surgery to help prevent blood clots. We do everything we can to prevent that. It's very, very unusual after tummy tuck surgery, but we want to keep you moving.
So how soon can they return to exercise?
The walking is good the first week. Cardio machines are fine the second week. I just don't recommend anything that's high stepping like a Stairmaster, because anytime you raise your legs up, it pulls on the abdominal muscles. But usually crunches, you ought to wait 3 to 4 weeks before you start trying those. Then a couple at a time and with your knees bent, and try to work that in. But other exercises you can get in after 7 days, because with the tummy tuck itself, we're not doing anything to your chest, and so or arms, and so you can work those well. But your stamina will be decreased a little bit, but just when you're tired, rest and just keep working. I really like to push the patients, because I think they just simply do better. The more you move around, the better you'll feel.
So after you have a tummy tuck, do you have to go back to doing all those crunches, or does it fix all that?
Well, it does tighten the muscles up, so that you will have a flatter tummy even if you don't do any crunches. We encourage exercise. You don't have to do 1,000 crunches to get that tummy you like, but you ought to do at least 20 as part of your routine, just for general fitness.
So what did patients tell you after surgery? Was it worth it?
Definitely. Most of the patients simply can't believe how good they look. They almost have tears in the eyes the next day when we take everything off, and they look, because they've been looking. Sometimes they see more they've seen south for quite a while, But they don't see the big tummy anymore. They look more like they did in their earlier years, maybe their teenage years even. So they really are almost tearful when they first look at themselves.